Carole is our Associate Dean for Clinical Affairs, and she's going to talk to us a little bit about the clinical operations at Hopkins and what we can do as faculty.
Hi. I just want to say welcome. It's an exciting time for all of you. I'm going to talk about the Clinical Practice Association and a little bit about the Office of Johns Hopkins Physician. So this was an elusive entity to me, so I thought I would just break it down to the basics, because honestly, until I started my position, I didn't really understand what CPA was whenever our department would talk about the CPA, and we would hear about it. So what is the CPA? It's the clinical practice in aggregate of all the departments. So each of our departments kind of put together, make a multi-specialty practice that is the Clinical Practice Association. And that is made up of physicians, APPs, all really billing clinicians within each department and together through the School of Medicine. Who's a member? Each one of us as faculty members is a member of the Clinical Practice Association. So any of us who bill basically under the Hopkins tax ID number. The leaders of the CPA who vote are the Board of Governors, and those are our department directors. So 21 clinical department directors make up the Board of Governors. Our Dean and CEO, the Executive Vice Dean, and the Vice Dean of Faculty. It's actually the Vice Dean of Clinical Affairs, is what I should say, are voting members. And do the faculty have representation? And faculty do have representation. We have 3 faculty senate representatives who serve on the Board of Governors, and they're ex officio, meaning that they don't vote. So what is the purpose of the CPA in terms of the bylaws? And this goes back to, I think, the late 80s when they wrote the bylaws. And the paramount purpose of the CPA is to support the academic mission and the educational process of the School of Medicine. And so it's really, if you are a clinical practice, you want to attract as much volume as you can and ensure that referrals are going pretty smoothly and that you have good clinical operations. And so functionally, I think we still remain true to the goal of improving organizational effectiveness and fostering medically appropriate referrals and aligning ourselves so that we can maximize our academic missions while being clinically productive, and to serve as a clinical voice for the faculty within Johns Hopkins School of Medicine. So what do? We try to foster strong financial performance for the clinical practice so that we can have competitive compensation, and I hear there's good forecasts coming in that realm. Support for the educational and research missions within the School of Medicine, and provide resources for the practical growth, for the practice growth. We do a lot of work with compliance, which we, the departments also then work with you as the faculty on that. Practice growth, so there have been clinics, for example, of headache that needed the CPA to help so that we had the right people across different departments. And then we also work in terms of standardizing clinical operations. So how many people are in clinic, what kind of resources we each have in clinic, what does our clinic session look like when we're in clinic, and we're also working with the health system in terms of procedural suites and operating rooms in terms of clinical operations. We also partner with the Office of Johns Hopkins Physicians, which I'll review in a second. But Office of Johns Hopkins Physician, how does it relate to us as faculty members? I think the biggest thing is when we have uninsured patients, there's a program TAP that goes through the Office of Johns Hopkins Physician. Also, billing changes all along, and so there is a strong billing education program through the Office of Johns Hopkins Physicians, and I'm going to show you the website that you can always visit. They also do a lot of courses and webinars so that whenever something new comes up in terms of billing, we get webinars and refreshers on these. So it's a very helpful office in terms of what we do clinically. They also run a program in value-based care and oversee the ambulatory quality and safety program. So examples of recent initiatives that the Clinical Practice Association has led is working on the clinical standards. And so you might hear from your department that, the CPA wants us to work on this, or the Office of Johns Hopkins Physicians. And what we're trying to do is create kind of equitable standards across the School of Medicine so that we can maximize how we all refer and our ability to have capacity to see each other's patients. So examples are a 4-hour clinic session, meaning when we go to clinic, the ideal is that we use that entire 4-hour time to see patients. We worked on setting clinical activity expectations so that they're equitable and transparent across the School of Medicine, meaning if I am 80% clinical, what does my schedule look like? How much clinic, how much OR time, and that it would be the same expectations for anyone who's 80% within my department. And each department has different definitions that they might talk to you about. And as I said earlier, staffing and space is something that we're working on now. A big thing that those of you who have already started and those who are starting is our in baskets with Epic have really, they've ballooned across the country. And the CPA and Office of Johns Hopkins Physicians have partnered to optimize in-basket messaging so that it reduces the amount of time that we as physicians are in the in-basket. We've also had efforts to leverage telehealth, and we're rolling out a digital scribe opportunity that will hopefully help people in clinics. And as I said earlier, practice growth and multidisciplinary program support are other examples. So you'll hear the term Office of Johns Hopkins Physicians, and I think of it as kind of the effector arm of the CPA, and it's really the umbrella, and it's kind of the what ties the School of Medicine to the health system to really execute on the delivery of care. It oversees the ambulatory services and patient access, which is the call center, and quality and safety. So here are kind of the OJHP functional areas, and you'll see all the way here is the School of Medicine, the clinical practice, which is us physicians, where we how we see patients. Then there's the health system, or their different entities, and then all the way to my left, your right, are the functional areas of OJHP, which is telemedicine, strategic recruiting, market planning, the learning center, and so it is what kind of brings everyone together so that we have a productive clinical practice. I'm going to show you this before I give you our contact information. So OJHP has a website, and it has all the educational materials that I think would be helpful for you in terms of in-basket optimization, all the billing and coding, risk adjustment. As there are updates, they go to this website, and that's also where you can find courses. If you're, when they went to time-based billing, for example, that was kind of something new to wrap our heads around in terms of billing. And so they put all that information there. So I think it's a great website to check on throughout. And I didn't know about it, honestly, till late in the game. So in terms of contact information, if you have any questions, please don't hesitate to reach out to me. Melissa Hellicky is my administrative counterpart, and she also works in OJHP as the COO. And Rick Redette is the Vice Dean of Clinical Affairs and the interim president of the Clinical Practice Association. If you have ever any concerns, if you have any questions, if you ever have any ideas or suggestions on how to make something better and something that we could do all together across the School of Medicine to make us more efficient and operationally better, please don't hesitate to let us know. Sarah Conway is the interim senior vice president of OJHP also, and her contact information is here as well. And then at the bottom is the website for OJHP.